Hello, a very good morning to one and all. I'm Dr. Shrutika. I welcome you all back to our new YouTube video today. So today's YouTube video is the continuation of the series that we are doing on views of Hahnemann on case taking. This is the third part of the series that we are being doing. So yes, so going up ahead, firstly to understand the videos into a series or into a sync, you should first go on to the part 1, part 2, and likewise you can come up to this video later on once you complete the first two videos, so that you will get a complete understanding that what we have learned till now, so that आप वो एक sync में आ जाओगे जो पहले हमने लिया सारी चीजें आपको link हो जाएगी. So the only purpose for all our videos is to create understanding. कोई भी चीज अगर आप पढ़ने के लिए पढ़ोगे या उसका कंसेप्ट समझ के नहीं लोगे या फिर ऐसे एग्जाम देना है उसके लिए पढ़ोगे तो याद नहीं रहेगी. सो इफ वंस यू हैव दैट अंडरस्टैंडिंग ऑफ कॉन्सेप्ट इन योर माइंड, then it becomes very easy to answer questions, to apply these teachings of Dr. Hahnemann, which has been mentioned in the Organon of Medicine from aphorism number 83 onwards in his Organon book. So it becomes very easy to connect while taking the case, while writing any exam, for preparing for any kind of exam. So सारी चीजें link up हो जाती है. Okay. So the part 2 was about, let's do the revision of previous video. So whenever we are starting up a new video, we always do revision of previous lecture, because then you get into that link. जो मैंने बोला ना, अगर ये सीरीज में चल रहा है तो अगर एक 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 वीडियो आप देखते आगे बढ़ोगे, so you will be into the link and you will understand it in a better way. So you will have to not keep going through these videos again and again. Once you go through it is okay, and you can always come back for revision. So let's get started with today's video. So let's start with the revision of previous lecture. So last lecture में हमने क्या क्या सीखा? We saw about aphorism number 84, which was about recording of symptoms. Then it is aphorism number 85, which mentions new symptom on fresh line. Aphorism number 86 is about physician's observation. Aphorism number 87 is about details of symptoms. Aphorism number 88 is about use of general expression. Aphorism number 89 is about precise and special. And aphorism number 90 was about observation, that is physician's own observation. Okay, so in this video or in this lecture, we are going to do aphorism number 91. What is aphorism number 91 about? It is about the past treatment and recording. Now, what has Dr. Hahnemann mentioned in this aphorism? Let's understand. The symptoms and feelings of the patient. Okay, I'll just take this up ahead so that we can have a complete view. Okay, so the symptoms and feelings of the patient during a course of medicine do not furnish the pure picture of the disease. But on the other hand, those symptoms and ailments which he suffered from before the use of the medicine or after they had been discontinued for several days give the true fundamental idea of the original form of disease, and these especially the physician must take note of. So whenever we are giving any taking any case, कोई भी patient हमारे पास आता है तो he comes up with the prescription sometimes कि ये medicines मेरे चल रहे हैं, मेरे को ये I have this problem since 2 to 3 years or whatever maybe the time duration, and these are the medicines. So to understand the true picture, what is the true fundamental picture of the disease, you should ask the patient कि ये दवाइयाँ लेने से पहले आपको क्या तकलीफ होती थी. What were the symptoms you were having before taking these medicines and after discontinuing these medicines, so that you get a pure picture of the disease. This is what has been mentioned by recording what past treatment the patient has taken and what were the symptoms prior to taking that treatment. Okay, now when the disease is of chronic character and the patient had been taking medicine up to time he is seen, the physician may we with the advantage leave him some days quite without medicine, or in the meantime administer something of an unmedicinal nature, or and defer to a subsequent period the more precise scrutiny of morbid symptoms in order to be able to grasp in their purity the permanent uncontaminated symptoms of the old affection and to form a faithful picture of the disease. What is Dr. Hahnemann trying to say into this aphorism is whenever a patient is coming up to us, and if he is coming up to us with a prescription, lot of prescriptions, or he is onto some medicine and you have to start your treatment. So to get that original unmodified picture, the true fundamental picture of the disease, what is important ki you take the case, probably don't give any unmedicine, don't give anything which is medicine, so that the true picture will come up and then you can prescribe on the faithful picture of the disease. So this is what is given in aphorism number 91 about past treatment and recording. अभी इसमें याद क्या रखना है? हैनीमैन ने बोला, क्या बोला है? The two things, medicine देने to before case taking, what is in the course of casing, what is important to ask the past treatment and what is the true picture of the disease before starting any medicine. And the second point that we understood right now. Going up ahead, ऐसे अगर आप ये करेंगे तो it becomes very easy to understand things. Okay, now aphorism number 92 is about acute disease recording. So what are the guidelines of Dr. Hahnemann in case of acute disease? But if it be a disease of rapid course and if its serious character admit of no delay, the physician must content himself with observing the morbid condition, altered though it may be by medicine, if he cannot ascertain what symptoms were present before the employment of the medicine, in order that it may at least form a just apprehension of a complete picture of the disease in its actual condition, that is so called the conjoint malady. So whenever a patient is coming up to us in case of acute disease where the course of disease is very rapid and very intense in nature, so उधर हम patient को hold नहीं कर सकते ना, उधर we have to prescribe the patient then and there itself. So whatever is the clinical presentation of the picture, what is the clinical presentation of the patient into that clinical or acute disease condition, we have to prescribe on those presenting symptoms. That is called as conjoint malady. So conjoint malady formed by the medicinal and the original disease. Maybe the symptom that is came up to the patient is because of the medicinal side effects that he is going through earlier, or because of any other maintaining cause or any other thing, and the original picture disease, we have to form the conjoint malady and prescribe the medicine. So conjoint malady formed by medicinal and original diseases which form the use of inappropriate drugs is generally more serious and dangerous than was the original disease, and hence demands prompt and efficient aid. And by thus tracing out the complete picture of the disease, he will be enabled to combat it with a suitable homeopathic remedy so that the patient shall not fall a sacrifice to injurious drugs he was swallowed or he has swallowed. So this is what is Hahnemann trying to say in aphorism number 92 about acute disease recording with emphasis on conjoint malady. तो याद क्या रखना है कि aphorism number 92 is about acute disease recording, in which Dr. Hahnemann has mentioned about conjoint malady. What is conjoint malady? A conjoint malady is formed by medicinal and original disease symptoms. Okay. I hope you are getting what we are doing. So going up ahead, next we have हम ज्यादा ही आगे चले गए. Wait a minute. We were here, we did this. Now we have aphorism number 93. Now aphorism number 93 is about private. So what do you mean by this private? So if the disease has been through on a short term or in case of a chronic affection, a considerable time previously by some obvious cause, then the patient or his friends, when questioned privately, will mention it either spontaneously or when carefully interrogated. So whenever a patient is on a chronic disease or chronic affection, so it is like कि कोई symptoms अगर patient को बहुत टाइम बहुत सालों से है, patient tend to neglect those symptoms because it is there, so he thinks that this is something not characteristic, it is common to me. So whenever we are emphasizing on these parts to get more precise information in case taking, so we can do a private question or question the patient privately to get a careful interrogation of what information we want. We can have the information directly from the patient or from the friends or attendants which are associating with the patient. Now, aphorism number 93. Any causes of disgraceful character which the patient or his friends do not like to confess. Abhi, whenever we are talking about the mental aspect of the patient or trying to know the mental state of the patient, the mental disposition of the patient, तो पेशेंट खुद से आके कुछ बताएगा कि मैंने ये किया है, मैं ऐसा हूं, मैं वैसा हूं. No, we all try to cover up ourselves. This is the defense mechanism. So how we will frame our questions to get the precise information to prescribe the right homeopathic remedy? This is what has been given in aphorism number 93. That is, key any causes of a disgraceful character which the patient or his friends do not like to confess, at least not voluntarily, the physician must endeavor to elicit by skillfully framing his question. आपने किसी को दुख दिया है क्या? Are you going through any heartbreak? We cannot ask these questions to the patient directly, so we have to frame our questions skillfully. We can ask like, what is the most stressful event in your life where you have experienced the most tremendous stress tension in your life? So this could be one of the examples of eliciting more precise question. So to these belonging poisoning or attempted suicide, onanism, indulgence in ordinary or unnatural debauchery, excess of wine, cordials, punch, or other ardent beverages like coffee, overindulgence in eating generally, or in some particular food of hurtful character, infection with venereal disease or itch, unfortunate love, jealousy, domestic infidelity, worry, grief on account of some family misfortune, ill usage, balked revenge, injured pride, embarrassment, or of a pecuniary nature, superstitious fear, hunger, or an imperfection in private parts, or rupture, prolapse, or so. To get whatever examples that we read now, to get more precise information about all the things mentioned over here, we have to frame our questions very skillfully so that a perfect picture of the disease can be traced. But the questions are to be traced or are to be framed very skillfully. We cannot ask direct questions to the patient. We have to ask open-ended questions to the patient. Going up ahead is aphorism. So aphorism number 93 में याद क्या रखना है about private questions, how we have to skillfully ask the questions, how we have to frame our questions and ask it to the patient so that we get the precise information. Okay. Aphorism number 94 is recording of maintaining cause. Now, while inquiring into the state of chronic disease, the particular circumstance of the patient with regard to his ordinary occupations, his usual mode of living and diet, his domestic situation, and so forth, must be well considered and scrutinized to ascertain what there is in them that may tend to produce or maintain disease, in order by their removal, the recovery may be prompted. So, agar there is some maintaining cause into a case of disease and we have been giving medicine and the patient is not getting better or getting partially better. So, in that situation, we need to understand ki what is the work environment of the patient, where is the patient living, what is his domestic situation, what kind of lifestyle or what kind of diet is the patient having. अगर कोई patient आ रहा है हमारे पास saying he's having, for example, cramps in his legs, so which is a sign of vitamin B12 deficiency. So if we don't know what kind of diet or what kind of living the patient is having, so we will not be able to understand what is the maintaining cause of that disease. So we have to consider, जो केस टेकिंग में हम सारी चीजें पूछते हैं ना, ऑक्यूपेशन ऑफ द पेशेंट, रिलीजन ऑफ द पेशेंट, एड्रेस ऑफ द पेशेंट, so all these things carry importance to know the maintaining cause of the disease. ये हम पेशेंट को क्यों पूछते हैं, ऐसे ही पूछते हैं क्या? नहीं. So to understand the maintaining cause of the disease, so that if this maintaining cause is removed from the disease, maybe recovery will be prompted easily. Going up ahead, in chronic disease of females, it is especially necessary to pay attention to pregnancy, sterility, sexual desire, accountments, miscarriages, suckling, and the state of the menstrual discharge. So, if कोई patient अगर आ रहा है अपने पास कि about pruritus or about any kind of genital itching, so it is very important for us to understand whether the patient is taking maintaining proper personal hygiene or not, or what is it that is maintaining the disease. So with respect to all these things, pregnancy से related, sterility से related, sexual desire से, miscarriages, suckling, the state of menstrual discharge. So with respect to the last name more particular, we should not neglect to ascertain if it recurs at too short interval. So menses से related अगर कोई चीज है तो कितने time के बाद आते हैं? What is how is the character of flow? Is there any smell? Is there any associated leukorrhea? Is there any pain? So all these accompanying information is very much important to understand for us. So we should not neglect to ascertain if it recurs at too short intervals or is delayed beyond the proper time, or how many days it lasts, whether it flows is continuous or interrupted, what is its general quality, how dark is the color, whether there is leukorrhea before the appearance or after its termination, but especially by what bodily or mental ailments, what sensation and pains it is preceded, accompanied, or followed. If there is leukorrhea, what is the nature, what sensation attends its flow, in what quantity it is, or what are the conditions and occasions under which it occurs. So these are getting more detailed information of the particular symptom is very important to understand the maintaining cause. Okay, so going up ahead, next we have horizon number 95 is about recording of long suffering. Recording of long suffering. So in case of chronic disease, the investigation of the signs of disease above mentioned and all other must be pursued as carefully and circumstantially as possible, and the most minute peculiarities must be attained to, partly because in these diseases they are the most characteristic and least resemble those of acute disease, and if a cure is to be affected, they cannot be too accurately noted. Partly because the patient becomes so used to it, their long suffering, that they pay little attention. अगर कोई किसी पेशेंट को लॉन्ग टर्म से कोई सिम्टम है, सो ये व्हाट ही फील्स दैट ये तो मुझे बचपन से ही है, तो अभी कैसे बताने का पेशेंट, मतलब इज इट इम्पोर्टेंट, और पेशेंट गेट्स हैबिचुएटेड टू दिस I have acidity problem every day, so he feels that he is having acidity problem, so it is not important for the to tell the doctor. So वो जो भी उसको बाकी के तकलीफ होते हैं वो बताएगा, ये चीज नहीं बताएगा. So we have to address each and every point, so where we can elicit a characteristic symptom out of it. Okay, now going up ahead, so partly because the patient becomes so used to their suffering that they pay little or no heed to the lesser accessory symptoms, which are often very pregnant by meaning, characteristic, often very useful in determining the choice of the remedy, and regard them almost as a necessary part of their condition, almost as health, the real feeling of which they have well being forgotten in the sometimes 15 or 20 years of sufferings, they can scarcely bring themselves to believe that these accessory symptoms are having a connection with the principal malady. So this is very important. So recording of long, अगर कोई patient को long chronic case का आप case taking कर रहे हो, so to find the accessory symptoms of the case, यहाँ पे simply इतना ही बोल, what Hahnemann, Dr. Hahnemann is trying to tell is कि if we are taking any chronic case, तो वहाँ पे to accessory symptoms को और डिटेल में एसेस करना बहुत जरूरी है, क्योंकि पेशेंट को वो बहुत टाइम से होता है, नहीं डजंट फील इट इम्पोर्टेंट टू टेल टू द फिजिशियन कि ये होता है. He pays less attention to it. So as a physician, it is our responsibility to elicit more information about it. So yes, so we are done with this video. So I have tried keeping the videos into parts to make it more crisp and precise, so that it doesn't be too big for you all to go through it. So my intention is to make it very precise and concise and to provide you with the correct authentic literature. So what we did into this was about revision we did. Then we went in from aphorism number 91, which is about the past treatment and recording. Aphorism number 92 is about acute disease recording. Aphorism number 93 is about private. Aphorism number 94 is recording of maintaining cause. Aphorism number 95 is about recording of long suffering. So we did these 5 aphorisms in this particular video. So if you find this YouTube video useful, do not forget to subscribe to my YouTube channel. Keep sharing to your friends. So if you have any queries, any questions, if you want to suggest me anything, or if you have a particular thing in your mind on which you want video from me, so you can just post a comment below so that I can help you out, or we can have a better thing coming up ahead. So keep learning, keep sharing. Thank you and have a nice day.